Hello everyone, this is Dr. Hasnain with my amazing geniuses class. I am going to start the procedure of Foley's catheterization in a male. This presents in the form of performing in a male, but usually in a teaching when it comes to female catheterization. So today, everyone, I'm going to be telling you how to perform the Foley's catheterization. Okay, so what was the checklist of procedures that we learned today? Number one, what are we going to do first? We're going to explain the procedure. What's second step? Consent. Well done. We're done with the first pair. What is the second pair?
Exposure and position.
Well done. What is the exposure?
Below the waist.
Pair below the waist.
Legs separated.
Well done, Vivan. Okay. And then we have the third checklist pair. What is that? Privacy and chaperone. All right, John. So what I'm going to do is I'm about to perform a procedure on you. It is called Foley's catheterization. It will involve me passing a tube in your front passage. I will try to be as gentle as possible. All right, do I have your consent? All right, could you be bare below your waist for me and remove your undergarments and just part your legs and lie down for me? I will ensure your privacy and a chaperone will be present throughout the procedure. May I proceed? I have entered the procedure table. What is the first thing I'm going to do?
Clean area.
Well done. Examiner, where is my clean area and where is my waist area? All right, so always acknowledge. This is my clean area, this is my waist area. All right. Next step.
Gloves.
Well done. So this is a sterilized procedure. We have to up our game with the sterility, okay? We need to be super aseptic. So the first thing, I'm going to wear my apron this time and I'm going to glove myself. All right, and there's going to be many times that I'll be changing my gloves and re-wearing them. Okay, done. What is this next step? Collection and preparation. Now, in Foley's catheterization, collection, preparation are combined. Now, watch my 1, 2, 3 rule. Okay, one rule. First collection includes your, what is this, guys? Well done. This is a drape. You're going to drape the patient, okay? And make sure there's going to be a hole in the drape, so the penis should fit in the drape, all right? Done. First step, drape the patient. This is one drape collected. Let's go to the 2 rule. 2 trays, okay? I need one tray in the middle of his legs and a second tray on the side. The next 2 we need are the 2 syringes. All right, I'm going to collect my 2 syringes, one filled with anesthetic jelly and one with, what are we going to put in the balloon?
Water.
Yeah, distilled water. Understood, everyone? So 2 syringes. And finally, we need 2 tubes. The first tube is the main character of the story. What is this? Well done, Kuye. Okay. So, and the second tube is the urine bag. Put the urine bag on the side of the patient. So I am telling you the best positions to keep the things so it's easy for you. All right. Now, second thing, you're going to do the non-touch technique of opening the Foleys. Okay. So what you're going to do is first just take off the wrapper. Okay, guys. So once the wrapper is off with the non-touch technique, throw the Foleys between his legs. Okay. Put the Foleys between his legs. As you guys can see, yes, there was a wrapper outside, but the Foley's itself is also enclosed in a wrapper, you can say. This goes where? Where does this go? Waist area. So this is why we asked in the beginning, where is the waist area? So we don't make a mistake. Examiner, where is my waist area? This is my waist area. I don't need to ask anymore. That's there. Okay? Now, listen to me very carefully. 2s are done. 2s are prepared. Okay? We have 2 tubes. We have 2 syringes. And we have 2 trays. Next is the 3s. Okay? The 3s is 1 forceps, 1 gauze, 3 cotton balls. So 3 things and 3 cotton balls. Everybody's following me? Yes? Okay. So 1 forceps, 1 gauze, 3 cotton balls usually dipped. Suppose this is a saline or aseptic solution. Put them inside. Understood? Everyone understood? Yes? So 1 forceps, gauze and the cottons. And itself the cottons are 3. So 1, 2, 3 technique of preparation and collection of Foleys. So what is 1?
Drape.
Well done. What is 2?
Bags.
2
Tubes.
2
Tray and 2 tubes or syringes. Okay. And tubes. Well done. Okay. Next we have the 3s. What are the 3s?
The gauze.
Yes.
3 buttons.
Yes.
Forceps.
And forceps. Well done. Okay, 3 things are prepared. Now what are we going to do? Time to perform. The performance goes in the form of cut this part. The performance goes in the form of sterilize, anesthetize, insert. Understood? Say it after me.
Sterilize, anesthetize, insert.
Well done. Look, this is a genius class, I told you. So, what are we doing? Sterilize, anesthetize, and insert. Understood? First things first, people usually forget this step. The gauze is your best friend. The gauze is the first thing that will come on top of the penis. And you're going to hold the penis using the gauze. You are very sterile, okay? So done. I've held the penis from the gauze. Now the next step is take your forceps, take your first cotton which is soaked in aseptic solution. For instance, it's not that complicated. For instance, just one cotton, okay? What you're going to do, you're going to clean. How do you clean? You clean from inside, going outside, never bring it back again. So inside to outside, that's it. It's useless now. Waste area. You bring your next cotton, once again, inside, outside, throw. And finally, inside, outside, and throw both. Understood? Both things thrown. What is this? What is this step called?
Sterilize.
Well done. What is the second step?
Anesthetize.
Well done. Anesthetize. Now, once again, lift your penis this time to a 90-degree angle. Warn the patient, I'm about to give you some cold jelly. It will feel a little cold. All right? You're going to fully fill the penis in. And you're going to say, I would like to wait for 5 minutes for the gel to set in. All right? This is the most important part. Okay? 5 minutes, assume they're done. Okay? Next step is
Insert.
inserting time. Now, how do we insert? This is the point. I will change my gloves or wear new gloves over my gloves. That's up to you. Okay? You're going to wear more sterile gloves. All right? Like, you know how you do the, what do you call that thing? In the surgery, when you go to perform a surgery, what do you guys do? The
Glove.
what do you call it? The cleaning up, the
Scrubbing.
scrubbing up. So you're gonna wear the gloves in the form of how we did in the surgeries, right? We did it from the non-touch side and then put it on. And now you have proper sterile gloves. We're going to the Foleys. Why? Because Foleys is something that's going into the body cavity. The body cavity has never seen the germs out of the outside world. Okay, so we don't want any germ to get on the Foleys. Already we are gloved in such good gloves. And on top of that, we are not going to touch the yellow part of the Foleys ever. Okay, so first thing, I'm only going to open up the shopper